Welcome to 6ABC's Local Spotlight. The following advertisement is paid for by Mainline Health. Here's Jessica Boyington.
When you think all about all of the types of repetitive motions that we perform and the time we spend using our wrists and hands to write and type, push and pull, lift and grab, it's no surprise that the constant activity in this area can cause pain and injury over time. Injuries to the hand and wrist are common, often caused by trauma or overuse. So we're here today with Dr. Petrucelli, orthopedic surgeon at Mainline Health. He's going to talk to us about the treatment options available at Mainline Health for some of the most common hand and wrist injuries he sees in his patients. Doctor, thank you so much for joining us today.
Hi, Jessica. Thanks for having me. Great to be here.
All right. So who is at risk for these hand and wrist injuries and disorders?
So people in various occupations that engage in certain activities are at higher risk for hand and wrist injuries. And that includes people that have jobs requiring repetitive hand motions, like constant heavy lifting and using tools that have a lot of vibration. And we see this a lot in construction workers, assembly line workers, and mechanics. Then you have your athletes that are playing sports that require a lot of use of their hands, like basketball, tennis, golf, and especially gymnastics. They're all at higher risk. Then you have your musicians, especially your string players, like your guitarists or your violinists, that are constantly putting their fingers in awkward positions that places a lot of stress on them. And then, of course, with age comes osteoarthritis, which is degenerative changes in our joints over time.
What are some of the most common conditions or injuries that actually lead to that wrist or hand pain?
Yeah, so there are several common conditions that I see in the office all the time. And the most obvious is a break, also known as a fracture in the hand or the wrist, that can be very painful. There's compression neuropathies that you may know as carpal tunnel syndrome that can cause a lot of pain in the wrist. And then you have your tendinitises. A common one is decore veins, which affects the wrist and can lead to it being very painful.
All right, so I'm hearing that pickleball has become more popular in recent years. I did not know that, but how has this contributed to those hand and wrist injuries? I'm sure you see a lot of this.
Yeah, so everyone's playing pickleball these days, even more than tennis. I've had patients tell me they play pickleball up to 5 days a week. And I think it's great because it keeps them active and fit, but it is that same repetitive motion of swinging the racket that leads to these overuse injuries. And the most common one that you may have heard of is tennis elbow, which is tendinitis on the outside of the elbow. And then also, unfortunately, I see people on the court that are running for a shot. They have a trip and fall injury and might break a bone in their hand and wrist as well. So those are some of the most common things I see with pickleball.
How do people prevent some of these hand and wrist injuries?
So preventing hand and wrist injuries involves a combination of proper ergonomics, recognizing the risk factors, and adopting a healthy lifestyle. So proper ergonomics means that your workstation at work is set up so that your desk and your chair are all set up, that they take a lot of stress off of your joints. And then also, if you're engaging in a lot of repetitive activities, taking a break, stretching your hands, stretching your wrist to take a lot of the strain off of that.
How would you diagnose some of these injuries?
So often we use a patient's history, a good physical exam, and then any diagnostic tests we need, which can include x-rays, ultrasound, a CAT scan, and even an MRI. And then once we can come up with the proper diagnosis, we're able to tailor your treatment plan to best fit your needs and give you the best outcome.
For any patients who are suffering with pain from these injuries, do you have treatment options that are available?
Yeah, and the mainstay in the first line of most of these conditions involves rest and activity modifications to really help relieve the strain that's on those joints. We often recommend seeing an occupational or physical therapist that will work on stretching and strengthening to help with any condition they have. And the next line of treatment is cortisone injections that can be very effective for a wide variety of conditions. And when all those conservative options fail to provide relief and you're having persistent or severe hand and wrist pain, then surgical intervention may be necessary.
Well, thank you so much for being here and sharing this information with us.
Thank you so much. It was great to be here. Thanks for having me.
To learn more, you can visit mainlinehealth.org/wellaheadphilly. Thanks so much for watching and have a great rest of your week.
Thanks for watching 6ABC's Local Spotlight. The preceding advertisement was paid for by Mainline Health.